Dear students, stretch reflex is a very important topic both for the MCQ and for the MBBS exam. So today we will try to learn important points of stretch reflex so that it will be easy for you to answer in the Viva table, in the theory question as well as in the MCQ. Before going to stretch reflex, a few words about the reflex itself. What reflex is? Reflex is an automatic, involuntary, reproducible response to a sensory stimuli. All these 3 points are very important: automatic, involuntary and reproducible. So here we can see that a stimulus is given here in the form of heat. It may be pain, it may be touch, vibration, anything. So any kind of stimulation that is given to our body, so there will be automatic, involuntary withdrawal of this hand. So this is a response. So this is an example of reflex. So it is an automatic, involuntary and reproducible response to a sensory stimulus. Reflexes, they act via reflex arc, or it is a pathway of reflex activity. Now what are the components of this reflex arc? So first is the receptor, which will actually recognize the stimulus. It may be the touch, pain, temperature, any kind of stimulus that will be recognized by a transducer organ known as receptor. What is the function of this transducer organ? It will generate a generator potential over here. And the potential generated in the receptor, it is not an action potential, it is a graded potential or generator potential, so that if we increase the intensity of stimulus, that can be summated. So the receptor generator potential can be increased in intensity. So the second component is this response, this receptor response will be carried by a sensory nerve or the afferent nerve. Now this afferent pathway, it is actually here there will be generation of action potential. As action potential has a propagatory nature, so this response will be propagated to the central nervous system. Now in the center, the third component is the central nervous system or the center. This is an integrating area in the CNS formed by one or more synapses, and it actually connects this afferent pathway or the sensory pathway to the efferent pathway or the motor pathway. Now the fourth component. So first is the receptor, second is the sensory or afferent nerve, then is the center. Fourth component of a reflex arc is the efferent path or the motor nerve. So it will carry the command of the central nervous system to the effector organ. The effector organ can be muscle or a gland. And the fifth component, it is the effector organ. So in response to the command of the central nervous system, either there will be a contraction of muscle or the secretion of the gland, that is the response. So there should be a cause and there should be a response. The cause is the stimulation in the form of pain, touch, temperature or anything, and response should be either in the form of response of the effector organ, which may be muscle or the glands. So here in the nutshell we are giving some concept about the functions of these 5 components. Receptor will receive the information, afferent neuron will carry the information, interneuron will process the information, efferent will receive the command and it will carry this command to the effector organ, and the effector organ will respond. Now we know what is reflex, that is the definition of reflex, and what are the components of reflex arc. With this idea, now we will try to describe the stretch reflex. So what is stretch reflex? Stretch reflex is nothing but a monosynaptic reflex. It is initiated when a muscle is stretched, and so the cause is stretching of muscle. And what is the response? As a result of this stretching, there will be muscle contraction. So stretch reflex is a monosynaptic reflex It is initiated when a muscle is stretched, and this results in contraction of the stretched muscle. So these are few examples of stretch reflex. We can see here, this is the knee jerk, triceps jerk, biceps jerks. These are the examples. So stretch reflex means it is a reflex, so it must have a reflex arc. Now we want to know what are the 5 components of the reflex arc of stretch reflex. So the first component, that is the receptor for the stretch within the muscle, is the muscle spindle or the intrafusal fibers. Regarding the sensory nerve, there are 1A and 2 type of fiber which will carry the information to the spinal cord. We know that at the dorsal root of the ganglia, the cell body of these afferent nerves are located, and the actions will enter through the dorsal root of the spinal cord, and they will relay in the spinal cord. And the command in the spinal cord, it will be carried by the efferent nerve or the motor nerve, the alpha motor nerve, and which will go to the effector organ or the extrafusal fibers over here. So the 5 component, first is receptor, that is muscle spindle, then the sensory nerve, that is 1A and 2 type of fiber, and then there will be relay station. Third is the efferent pathway is the 4th one, which is carried by the alpha motor neuron, and the effector organ is the muscle extrafusal fibers. So you can ask, what are the extrafusal fibers? Intrafusal fibers, we have read about the muscle fibers, the actin, myosin, troponin, and their contraction. We have never heard about this. So it is seen that in the muscle bulk, only about 10 muscle fibers, they are indistinctly striated. Okay, these indistinctly striated muscle fibers, they do not directly contribute to the contraction of the muscles. They lie parallel to the other fibers. Now, from now onward, we will call them muscle spindle or the intrafusal fibers. All the rest of the fibers, they are the extrafusal fibers. These fibers, these intrafusal fibers, their ends are connected to the sides of the extrafusal fibers. The intrafusal fibers are of 2 types. One is the nuclear bag fiber, another is the nuclear chain fiber. So nuclear bag fiber, it is so called because its central portion is dilated like a bag and it contains many nuclei. We can see here. And out of these 10 fiber, which are the intrafusal fibers, 2 fibers are the nuclear bag fiber. One is the nuclear static bag fiber, another the dynamic bag fiber. Another fiber is the nuclear chain fibers. These nuclear chain fibers are shorter and thinner, and their 2 ends are attached with the nuclear bag fiber, and nuclei in these fibers, they are not located at the central portion. They are attached or they are present linearly in a single line. Now so these are the receptors for the stretch, nuclear bag and nuclear chain. Now nuclear bag can be of dynamic nuclear bag fiber and static nuclear bag fiber. Nuclear chain fiber is always a static nuclear chain fiber. Now what about their innervation or the sensory or afferent nerves arising from them? Here we can see the central portion of the nuclear bag fibers as well as those of the nuclear chain fibers, they contain aneurospiral ending, and from there the 1A primary efferent type of fibers, it is generating. So these 1A fibers, they are actually innervating all types of fibers, dynamic nuclear bag, static nuclear bag, and the static nuclear chain. Another type of fiber we can see here, which actually have the flower spray ending near the peripheral end. From this group 2 afferent fibers, group 2 afferent fibers, they arise. So we can say here this 1A, they actually take the information from dynamic bag, static bag, static chain, and this type 2, it takes information from static chain and static bag. Now what do we mean by this dynamic and static, and also by this 1A and 2? So from the Erlanger and Gasser classification, we have classified the nerve fibers according to their diameters. Some fibers which are very thick fibers and myelinated, they are the A type of fibers. Some are less thicker, which are the C, and the B fibers and the C fibers are totally unmyelinated fibers. Now this A fiber was further subdivided into A alpha, A beta, A gamma and A delta according to their diameter and the nerve conduction velocity. Here we can see that this A alpha fibers, they are denoted as 1A, whereas these beta sensory fibers are denoted as type 2. So we can say that this 1A and 2 sensory fibers, their name is denoted by due to their or according to their thickness and the nerve conduction velocity. Now how this stretch reflex happens? When a muscle is stretched, the muscle spindle lying parallel to the extrafusal fibers, they are also stretched. The stretch in the intrafusal fibers will be transmitted to the central portion via this 1A or 2 type of afferent neurons. Now these neurons, they will synapse at the central nervous system or the spinal cord, respective spinal cord, and they will excite the alpha motor neurons which are present at the anterior motor horn cells. And from these alpha motor neurons, the motor fibers will come out, they will carry the command and they will supply the extrafusal fibers, and these extrafusal fibers will contract. So when the muscle is stretched, so this information will be carried to the CNS via this 1A and 2 fiber, and the command of the CNS will be carried by the alpha motor neuron, which will cause the contraction of the extrafusal fibers, and there will be shortening of muscle. Now here one point is important. When muscle contracts, when the two ends of the muscle, they come nearer or closer, the muscle spindle becomes totally slack or relaxed. So no impulse will be carried by it. It reduces the reflex motor neuron discharge and the muscle tends to lengthen. So these also act as a feedback mechanism, negative feedback mechanism. When a muscle is stretched, contraction is happening. This contraction will cause the relaxation of the muscle spindle. So there will be no further stimulation of this muscle spindle and the muscle will lengthen. So to summarize, stretch or myotactic reflex is a reflex contraction of a muscle when it is passively stretched. And what is the component of the reflex arc? The stimulus is the passive stretch, receptor is the muscle spindle or the intrafusal fibers, afferent is the 1A or 2 type of fibers, and the center is at the central nervous system is the spinal cord, and there will be efferent fibers are the alpha motor neurons. Effector organ is the extrafusal fibers, and what is the response? Response is muscle contraction. Now few extra points that we want to add. What do we mean by the static stretch reflex and the dynamic stretch reflex? So dynamic stretch reflex, we know that it is sensed by the dynamic nuclear bag fiber, and the information is carried by the 1A type of afferent or sensory fiber. These nuclear bag fibers, they are sensitive to the rate of change of length, that is increase in length, decrease in length. This rate of change will cause the stimulation to this dynamic nuclear bag fiber. They can quickly detect any change of length and initiate corrective movements. Whereas the static stretch reflex, we know that it will be sensed by the static nuclear bag and the nuclear chain fiber, and the information will be carried by the 1A and 2 type of fibers to the central nervous system. They actually detect the total length. So the information that is given by this stretch reflex to the central nervous system is the length of the muscle. It may be the rate of change of length, that is the dynamic length, or it may be the total length. And dynamic stretch reflex, it is a short lasting reflex, whereas the static stretch reflex, it is weak reflex, but it is a prolonged contractile response and it maintains a constant muscle length. The static stretch reflex is responsible for maintaining muscle tone. Now we want to know few other points which are very important related to stretch reflex. That is the role of gamma motor neuron in the stretch reflex. The terminal end of these intrafusal fibers, they are supplied by a special type of motor nerve fiber known as the gamma motor neuron. These fibers are small diameter fibers, and we know that at the anterior motor horn cell we got the alpha motor neuron. 30% of motor fibers or motor neurons is and this anterior motor horn cell, they are gamma type of fiber. Some are beta, some are alpha, most of them are alpha, but 30% of it are the gamma fibers. Now the gamma fibers, they end into different types of endings at the terminal part of this intrafusal fibers. One is the dynamic gamma motor neurons. Their ending is known as the plate ending in a nuclear back fiber, and the static gamma motor neurons ending in the trail ending in the static nuclear back and the nuclear chain fiber. In both the cases, they actually end at the terminal portion of the intrafusal fibers, and they can cause a contraction of the terminal part of this intrafusal fiber. What are the functions of these gamma motor neurons? These gamma motor neurons themselves, they do not directly cause the muscle contraction, but indirectly they can lead to muscle contraction. How? So if these gamma neurons, they are stimulated, so they will carry impulse. These impulse will cause the contraction of the terminal portions of these intrafusal fibers. If the terminal parts are contracted, that means the central part will be stretched. So this nuclear bag region will be stretched and it will stimulate the aneurospiral ending, and just like the stretch reflex, the response will go to the central station, and at the central part they will form synapse with the alpha motor neuron. This alpha motor neuron will go to the extrafusal fibers and they will cause the contraction of the muscle. So gamma discharge, peripheral part of the intrafusal fibers contract, nuclear bag region is stretched, and the stretch reflex is initiated. So indirectly, the gamma neuron stimulation, they can cause the contraction of the muscle. Now the one point is important here. If the muscle is contracted, so it is stretched, this part of the muscle is stretched, as a response to this there is contraction of the muscle. Okay, so contraction means, we have already told you that if the muscle is contracted, these two Z lines, they will come closer, they will come closer. That means these intrafusal fibers, they are not stretched now. They are slacked, they are relaxed, and we know that this will cause the feedback lengthening, negative feedback reflex, or the lengthening of the muscle. But if we want to maintain a sustained contraction, how can we keep these intrafusal fibers sensitive to stretch? So this is done by alpha gamma co-activation. In this diagram, we also can see that muscle is contracting, two Z lines are coming closer, so the intrafusal fibers is now laxed and relaxed, so it is not stretched, so its aneurospiral ending is no more stimulated and it cannot cause further contraction of the muscle. In this picture too, we can see the same phenomena. But if alpha gamma co-activation happens, then the story will be different. So from this figure, we can have an idea of what is alpha gamma co-activation. So when a muscle is contracting due to the stimulation of the alpha motor fibers and the two ends are coming closer and this part of the intrafusal fiber is laxed now. Now what happens? There will be simultaneous activity or stimulation of the gamma fibers along with this alpha motor neuron. And gamma motor neuron discharge, it will be accompanied with the alpha motor neuron discharge due to this alpha gamma co-activation. And who will cause the stimulation of these gamma motor neurons? It is the supraspinal influences that are descending tracts that are coming from the central nervous system or the cortex. They will actually cause the stimulation of this gamma discharge, and there will be simultaneous stimulation of alpha and the gamma motor neurons. So this intrafusal fibers is not slack, not relaxed now. It can send the information of the length of the muscle fiber to the CNS in this case. There are certain important factors which can increase the gamma discharge. For example, the anxiety, nervousness, noxious stimulation of the skin. And you will see that if you cannot elicit the jerks in the examination hall, teachers ask you to do a maneuver that is known as the gymnastics maneuver. Strong stimulations motor act, for example, clenching of teeth, some other things, that is pinching your hand, so increase the gamma discharge, and there will be through irradiation it will influence the stretch reflex. So gamma discharge can be increased by these methods, and these are known as the reinforcement. Know the reflex arc of stretch reflex, we know the definition of stretch reflex, we know that how indirectly the gamma motors they can cause the stretch reflex, and alpha gamma co-activation maintains the muscle sensitive to stretch at all length, and the information that is given by the stretch reflex to the CNS is the length. It may be the total length or it may be the rate of change of